Good morning. Good morning, and thank you for joining us today. My name is Posh Charles, Senior Vice President of Administration here at Northwestern Medicine. On behalf of our health system, I want to thank Governor Pritzker and State Representative Ford for joining us today. We are here today to discuss one of the most common types of cancer, prostate cancer, and how it affects communities of colors differently. Northwestern Medicine is conducting breakthrough research to understand and reduce the racial health disparities, and we have several initiatives underway to improve health equity in our communities. Project HOPE, Health Outreach Promoting Equity, was part of our COVID outreach strategy. We started this program last summer to support the health and social needs of individuals that were at high risk for COVID. Clergy and Clinicians is a video series featuring our clinicians with faith leaders from the community to deliver valuable health information. And then our African American transplant program, led by Dr. Danae Simpson, is a program committed to breaking down barriers to transplant care in African American communities and provides world-class transplant care. Finally, we are focused as a health system on addressing social determinants of health and how they negatively impact health outcomes for all of our communities. At this time, it's my pleasure to introduce Dr. Nelson Bennett, urologist and director of the Men's Health Program here at Northwestern Memorial Hospital. Dr. Bennett has led many of our men's health initiatives in African American and Black communities, and Dr. Bennett will share his insights on the importance of being proactive in one's health and wellness. Dr. Bennett?
Thank you, Posh. Hello, and thank you for joining us today. We're on the cusp of Father's Day weekend. My name is Nelson Bennett. I'm a urologist and director of men's health here at Northwestern Memorial Hospital. I'm also an associate professor at the Feinberg School of Medicine. Since joining Northwestern Medicine, I've been engaged in community outreach, largely centered around men's health, but I always dedicate a portion of my presentation to advocacy, most importantly, advocating for prostate health, because prostate cancer disproportionately affects Black men. Black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. Why is this? I mean, we think that this is because Black men tend to have biological characteristics associated with more aggressive disease, possibly suggesting inherited risk factors. Also, you have to add in the environmental factors and the behavioral factors, such as social stress, smoking, poor diet, lack of exercise. If caught early, prostate cancer is very treatable. It's important for Black men by the age of 40 to advocate for their health by first seeing a physician, then talking to that physician, and then following through with the tests and the visits. Did you know that 1 in 7 African American men will develop prostate cancer in their lifetime? Next, I'd like to call up one of those 7 men who almost had a different outcome but never gave up advocating for himself. Please welcome State Representative LaShawn Ford.
Thank you, Dr. Bennett, and everyone for being here today. It's I would say, a jubilant day, knowing the outcome because of the care that I received here at Northwestern Memorial Hospital. I would want to definitely say that going through this was possible to come out on top because I had health insurance and I have health insurance. So before I get to my remarks, I think I want to encourage people to take advantage of all the money that the governor is spending to make sure people get covered in Illinois, because the things that we're talking about here today wouldn't be possible if people are not covered with insurance. So the ACA's cutoff date is August 15th, 2021. And I think that I encourage people to, if they want to advocate for themselves, they should get covered with insurance. President Obama worked very hard to make sure that people that ordinarily wouldn't have access to health care, they have it now. American citizens have access to health care. I thank Governor Pritzker for doing everything that he can to make sure that the message is out. And secondly, I would like to thank my friend, Dr. Huggett. He's right there with the long coat. And I think the longer the coat, the more you know. And so that's what I learned, the Dr. lingo. So Dr. Bennett, it's great to meet you. And this experience has given me new friends. I now have urologists as friends. Never intended to have new friends like urologists, but now I have 2 new friends. So thank you, Dr. Bennett, and I'd like to thank the entire physicians and staff at Northwestern Memorial Hospital for helping me in this journey. From day one, from the receptionist all the way to the doctors, I've been able to overcome the challenge and battle this unbelievable disease of cancer. It's because of the people here at Northwestern Memorial Hospital helped me get through this. So my journey with prostate cancer was definitely a journey, and I encourage all men, especially Black men, to make sure that you have conversations with your doctor about prostate health. I'm not going to go into any recommendations. The doctors are here for all of the medical questions that you may have. But what I will tell you is I'm very grateful that I have a mother that trained me up to make sure that you take care of yourself. From the beginning of my life, we always went to the doctor. We always made sure that our health was front and center. So I'm here to talk about my prostate cancer experience as I aim to share my story with people, because it's very, very personal to share a story about prostate, because we know what that means for men. But I'm happy to do it because I do know that what I went through could have been very different if I didn't advocate for myself to make sure that I could live. And what's amazing about my experience was it happened during a pandemic, and this hospital, not knowing that I was an elected official, during the pandemic, when I'm listening on the news that cancer screenings and cancer surgeries had been postponed, I found out in October of 2020, and in January 2021, I had surgery under the leadership of Dr. Schaefer. Dr. Schaefer, when we said, I was just wondering, how did he spend so much time talking to me about the situation, because I know doctors have other patients to see, but he actually took the time to make sure that I understood everything that I was going to experience. And it all came to pass that he did a good job taking that cancerous prostate out of my body. Governor Pritzker, I can't tell you how grateful I am for you to take the time to stand here together with us to raise the awareness for men to learn about their prostate health, and being willing to set aside time to stand with all of us today to increase their awareness. And so I thank you for that, and I'll never forget your generosity when I called and talked to you about it. And you said, we will do what we have to do to stand with you, clear the schedule, and we will also do what we have to do to make sure that we increase the awareness about prostate health in Illinois. And so I'm grateful to say that from the time that I was diagnosed in 2020 to February, the surgery was January 28th, I had my first 5K February 28th. That's how good the doctors are here. So I had surgery January 28th. February 28th, I ran a 5K, that's 3 miles. That's because of the health that this hospital provided for me. And so now, I could never do justice, but I can also say that the Lord has blessed me to be able to share my story, because even today, I got calls from people when they saw the story hit, saying that they're going to get their prostate exam. And that's encouraging, and that's why we're here today, to shine the light, to make sure that people understand that the cancer in the prostate doesn't have to be a death sentence. It's something that you can beat, and I think that people should make sure that they have a relationship with a doctor. And now I'd like to introduce my surgeon, Dr. Schaefer. In addition to his clinical excellence, Dr. Schaefer is an international recognized for his work in studying prostate cancer disparities in Black men. And when we talk about the disparities, it's a perfect example of how my situation could have been different. At the age of 48, I remember Dr. Schaefer said, this is an aggressive cancer, and we have to do something right away. And the difference in seeing a doctor and not seeing a doctor is a matter of life and death. So Dr. Schaefer, thank you so very much, and I look forward to a lifelong relationship with you as time go on, and please.
Thank you, LaShawn, Representative Ford, for that nice introduction. My name's Edward Schaefer, and I'm the chair of the Department of Urology at Northwestern Medicine and the Northwestern Feinberg School of Medicine. And I'd like to personally thank Representative Ford for speaking today. As a physician who cares for men with prostate cancer, I know how hard it can be to discuss your own personal cancer journey. And it takes courage, it takes true leadership to come forward and publicly share your personal experience. And in doing so, it highlights the importance of several things. First, health awareness. Second, self-advocacy. And lastly, a strong partnership with your physicians. And this is particularly important in LaShawn's case, and for men like LaShawn, as prostate cancer disproportionately affects men of African ancestry. And your story also brings to attention this important health disparity. So, LaShawn, I know that on this eve of Father's Day, you are going to act as an inspiration for all men to be strong advocates for their own health and their wellness as their families need them. I'm also very proud of our entire team here at Northwestern Medicine for coming together to bring you the care that you deserve and ensuring that you had a great outcome. And with that, it's my pleasure to introduce Governor Pritzker.
Well, thank you very much to Dr. Schaefer, to his entire team, for the amazing work that they do. And you know, Northwestern Medicine is one of the best in the world. And I'm very proud to be here at Northwestern Memorial Hospital to work to get the message out with Representative LaShawn Ford. You've shared your very powerful story, and you shared it with me in private, and it meant an awful lot to me. And I know that anybody listening will take seriously the entreaty by somebody who has been through it to go get tested, go make sure that you take care of yourself. Now's the time to do it. I want to say a few things about LaShawn. Representative Ford has demonstrated true grit, fighting through his illness without sharing his burden with more than just a few of those that he holds closest, and choosing to make his experience one that will save other people's lives. I want to recognize the strength of all of those who have crossed paths with cancer in their lifetime. Because the thing about cancer is, as Dr. Schaefer indicated, it's very personal. In one way or another, it's very personal for just about everyone. And I believe we should give all that we can to fight cancer, awareness, funding, extraordinary research like occurs here at Northwestern, so that our children, our children's children can live in a world where cancer is too rare to be so personal. As others before me noted, prostate cancer is the most common cancer in American men, after skin cancers. About 1 in 8 men overall receive a prostate cancer diagnosis in their lifetimes. 1 in 7, as indicated by Dr. Schaefer, for African American men. It's time, frankly, that we have a collective alertness to its pervasiveness. And just as importantly, it's time that our institutions all across the state, all across this nation, gave the racial disparities that plague so much of our healthcare access, outcomes, and delivery the fullest attention that they deserve. I'm very pleased to see what Dr. Schaefer and Dr. Bennett and Vice President Charles are doing to better understand how those disparities weave through prostate cancer treatment, a critical next step if we're ever going to dismantle this disease as we know it. And of course, the other piece of the equation is policy. And my administration has gone to great lengths to make healthcare more accessible and affordable for all Illinoisans. That includes, and again, working with LaShawn Ford, authorizing expanded telehealth coverage to increase healthcare access to vulnerable populations so that even in poor areas of our state or remote areas, the initial signs of cancer or other diseases, the symptoms, can be identified sooner, substantially eliminating the Medicaid backlog as we have in Illinois so that people can seek diagnosis and treatment without regard to their income level. We brought $250 million more from federal healthcare funding to the state of Illinois. We turned the healthcare and hospital transformation bill into law. We worked with the General Assembly to make Illinois the first state in the nation to offer healthcare access to undocumented seniors. All of this plays into the point that people can get tested for prostate cancer. You can get tested right now, and you should be able to get coverage so that it's free to you. And in April, I signed the Illinois Legislative Black Caucus's Healthcare and Human Services Reform Act into law, taking sweeping action to address inequities and obstacles in our healthcare services. I want to highlight that Representative Ford himself sponsored that legislation. Now think about that. He was working on that before he knew he had prostate cancer. He was working to make it fairer for people all across our state, black and brown, poor people, people who live in rural communities, people who really need our healthcare system now more than ever. He was working to help them get the coverage that they need and the kind of coverage that they need. And he did it while fighting his own personal battle against cancer. I mean, that legislation started being put together before you knew you had prostate cancer. And when you found out, you kept working on that legislation with your colleagues and got it done. And fighting that battle without any of your colleagues knowing. Fighting cancer takes tremendous courage. And fighting cancer while working every day for your constituents without telling anyone is just heroic. LaShawn Ford's strength of purpose, his bravery, his dedication to the people that he represents is truly an inspiration to all of us. And as we approach Father's Day, his story, his desire to make sure that this story got told, is a powerful reminder to make sure all the father figures in your life get screened and take care of themselves. LaShawn might not be with us today if he hadn't taken action. He hadn't advocated for himself. I'm honored that he confided in me, and I'm proud to stand with him in his plea to all Illinoisans. Make sure that those father figures in your life get tested. I also want to emphasize that clinics and hospitals all around Illinois have taken great care to keep everyone safe when they come in for services. So if you've been putting off those important healthcare needs and checkups over the last year because of COVID-19, please know that our healthcare professionals are just as invested in keeping you healthy as you are. And as more and more residents get vaccinated, there is no better time than right now to make sure that you're taking care of yourself. After all, as this last year made all the more clear, each day that we have together on this earth, healthy and whole, is the greatest gift of all. So thank you. Thanks for joining us this morning. And I'm happy to take questions. Also, the doctors behind me and Representative LaShawn Ford.
If the representative could come up and perhaps, LaShawn, walk us through the journey. Finding out thoughts that went through your head, and then dispel some of the misinformation that's out there that you had to overcome.
Yeah, Charlie, I would say the journey was, and thanks for that question, because, you know, I do routine health screenings all the time, and you know, at the age getting older, you know, you want to make sure that you're on top of your health. And you know, I went in for a colonoscopy because the Black Panther, you know, he really, I think people have to realize, so I made sure I had that. He encouraged me to do my colonoscopy at the age because it was time. And so through that process, I also requested a PSA test, exam. And the numbers came back abnormal. The numbers came back very high. I think they were like 12, you know, and the average, the doctors could tell you what it should be, but it was very high. Then we did another exam, Dr. Huggett there, right there all the way through, another exam, and it came back even a little higher. And so we make an appointment to Northwestern so that we could start really zeroing in on whether or not this was cancer or not. So it's really stressful when you have something abnormal happening and your number's high, knowing that this could be cancer, not knowing if it's cancer that's contained or it's already spread. So we come in, and this is where we start meeting Dr. Schaefer's team, the nurses and the receptionists that really were fantastic, and made sure that we got in during the pandemic. We were worried that during the pandemic it was going to be very difficult to have it, but we knew my numbers were very high. And so I got in to see Dr. Schaefer, and Dr. Schaefer immediately ordered an MRI. That's one of the processes to find out if, well, first he verified the numbers with blood work, then it was high. Then he ordered an MRI, and the MRI led to the need to go further to find out if it was conclusive that it was cancerous. So they wasn't rushing to try to do surgery. They were really being strategic to make sure that it was cancer. Then I had the biopsy. And the biopsy was what determined and made the final determination of whether or not it was cancer. And when Dr. Schaefer got the results back, we had to wait a little bit because the biopsy is pretty invasive. And as soon as the biopsy results came back and we were able to do the surgery, Dr. Schaefer got me in. And here's a twist to it. We were worried that it wasn't going to be able to have the surgery because of the pandemic, but others don't know that I had just recovered from COVID. So it's like, oh, geez. So I need to get this surgery right away, but am I going to be able to have surgery because I just finalized the days of COVID? We did the test. Dr. Schaefer said, get them in, and we're going to do the surgery. I had been cleared of COVID. So we did the surgery, and Dr. Schaefer kept me in the hospital overnight. And the hospital was great helping. Then I was released the next day, and the process just began to improve every day from then. And to the point that from January 28th to February 28th, I was able to run again. That's like God speaking volumes, saying that, you know, it's up to you how you want this disease to handle your life. And so it's a great testament that we have great doctors to help with the prostate. And to this date, I like I said, I have new friends and the Dr. Bennett and Dr. Schaefer that I never thought I'd have, but it's very good to have people that's going to take care of me.
So Sean, can I ask you about when you first requested that screening? It's my understanding, correct me if I'm wrong, that you were told, oh, you're too young, you don't need it. Medicine. Correct? If so, can you just talk about that key point about advocating for yourself and saying, well, you know, I think that I should get this now. It's important.
Yeah, I think that's good. Yeah, so I think the CDC or the science says that you probably start taking the prostate screenings at about 55. And so, you know, I think that it's important that that doctors, you know, start looking at medicine from the lens that's important to all race and ethnicities, because the science we know is geared toward the majority of the population. And so, yeah, I think that you have to advocate for yourself and make sure that you know when you go into that doctor's office that you want to order your own tests. So the doctors will give you the battery of tests, but if you feel that you want to have a prostate exam, you could very easily get it.
Why do you feel like it is time for you to have?
That's, you know, I think it's my mother, you know, that made sure that I always, you know, just do everything as it relates to my health. But it's really God just sending a message, because there's no, I think that's a good question too, because there are no signs that you have prostate cancer, especially when it hasn't spread it outside of the prostate. So there were no signs. So I think men should know that you don't have to, and you will not have signs until sometimes it's too late. And I'm sure the doctors here are cringing to make sure I say everything right. So you guys, that's what I experienced, no signs. And that's because it had not spread outside of the prostate. But I do recall Dr. Schaefer saying that this is an aggressive cancer and we have to move on it right away. Otherwise, it would be a painful death.
Why is it so important for you to come forward now? Complete the surgery, help is on the mend, we're able to work with the governor on the legislation. Why now?
Yeah, I never wanted people to send a message to my family, friends, and constituents that LaShawn Ford has cancer and they have to worry about Ford and cancer. The message that I've always wanted to convey was LaShawn Ford saw a doctor, he advocated for himself, and he was able to identify prostate cancer, and he had a good team of doctors, and they took it out, and he's running again. That's the story. And the story broke, when it broke about it, we have people calling saying they're going to get their prostate exam today, we've also had different conversations with people because people called and they said, this is great news. It wasn't the news that, oh my God, LaShawn, you could die. You know, this is the way I want men to see prostate exams and the life that you could live with prostate cancer if you detect it early. Because we detected it early, it's a different life expectancy for me. And I got a text from Willie Wilson, and Willie Wilson told me, you know, LaShawn, it's unbelievable because I had prostate cancer 15 years ago. And so with that being said, we know that if you detect it, if you treat it, it's not a death sentence. And so I'm a servant at heart, and I want people to make sure that they know that they can live with this. And I think it's important that people understand that God uses people. And I always pray that the Lord's will be done. And this is what he asked. I mean, he didn't tell me do it. You know, I'm not going to say that he told me to do this, but I do know that God wants you to use your life and make sure that you use it to help other people. And I pray that people recognize that help is out there, but you got to recognize that there's a problem.
Your attitude, my dad's attitude was, you gotta die from something. And he was almost resistant to treatment. He felt that Jack Daniels would be a better method. And it was very aggressive. He was on 6 months. I mean, it just took him away. So I thank you for your leadership and your public service on this issue, and Governor, for your support of my friend. I think this is outstanding. I think that people should get the message. I hope they do get the message, because this is treatable. It is something that you can't turn around, but you have to take control of your own medical self.
LaShawn, to the end of that story that we just heard, which is incredibly powerful, do you worry that when we talk about advocacy and healthcare disparities between black men and white men, the incidence of prostate cancer of black men and white men, and part of it just having to do with not having the same access to healthcare, to education, all of those things, what can be done to improve things so that, you know, other black men on the south and west sides of Chicago have that same access to the healthcare and advice that you have?
Michelle, I think that it's important to know that President Obama actually made sure that every person, every citizen that's poor, they have access to health insurance. You know, having Medicaid that the governor funds in the state of Illinois is just like having the insurance that I have. And people that have Medicaid should realize they have insurance. They don't have welfare. They have insurance, and they should use it. And so Northwestern, I know that they accept Medicaid, and I think that people should use their Medicaid and be proud to use it so that they can live a healthier life. Advocating for oneself is the key. You know, we can't accept the fact that people say that there's no access. I know access is limited for some people, but you have to go outside of your boundaries and find the help to advocate for yourself. It's not enough to just say it's difficult. Advocate for yourself. If you have Medicaid, use it. If you don't have insurance, try to get it. And if you can't get it, still go to the doctor. And Northwestern, I don't mean to put you on the spot, but they'll take care of you because governor funds hospitals that do charity care. And so no matter where you are with your finances, find a doctor, find a hospital, and get help. I got one. Yeah, he got one before Dr. Schaefer.
Yeah, at this juncture, where do you go from here?
Yeah. So I do have new friends, and Dr. Schaefer or Dr. Bennett will speak to, I want to hear them tell me again what I should be doing, so that's a good question.
Question for Dr. Schaefer or Dr. Bennett, just again speaking about why is it, if we can elaborate more, that Black men are more susceptible to prostate cancer? And, the governor mentioned the idea of the disparities that still lead through prostate cancer treatment. Can you elaborate on that and what more can be done as well?
Yeah, it's a great question, and I think the short answer to the question is we don't precisely know. We do, however, know that there are components of one's genetics that predispose them to develop prostate cancer and prostate cancers that can be more aggressive. And that is particularly true in men of African ancestry, more specifically men of West African ancestry. And then, as Dr. Bennett alluded to earlier, there's also a social component that may modify or modulate one's risk for developing prostate cancer. Part of that is environmental factors, exposures in your community, lack of access to primary care physicians. And so there's multiple factors that play a role in modulating one's risk for developing prostate cancer. And so that is something that we are all attacking. The scientists in the room and the politicians in the room are trying to attack together to really level the playing field. But I would say that one major step in terms of leveling that playing field is true champions like Representative Ford, because there are so few people who are willing to step forward and be advocates for and talk about their personal journey. And I always reference women who have survived breast cancer. They really are true champions for their disease. And Chicago and the state of Illinois needs more true champions like LaShawn Ford.
Could you answer his question? He wanted to know what's up with
Well, yeah, Representative Ford is cancer-free, and we'll continue to follow him and ensure that that is the case over the remainder of his lifetime. So I always tell my patients we're friends for life. Thank you.
Thank you. Governor, the picture up here.